With our current layout of our emergency department, we only have 35 workable rooms, and with a volume of 80,000 patients, essentially that comes out to about 2,500 patients per bed per year.
We've done that through efficient workflow processes, but we know that if we can bring that bed capacity back to the national average of 1,500 patients per bed, the workflow will be much better for the clinicians, and the experience will be much more positive for the patients and their family members.
Well, the new ER expansion project is one that's been much needed. Our current emergency department is too small at this point to help us expedite patients.
As part of the design process, we elicited feedback from our community members. 3 top things that we heard feedback on was privacy, climate control, and wayfinding. So we made sure to incorporate all 3 of those components within the design.
In the new ER, every room is going to be private. And the rooms are larger, so we can actually accommodate the patients' families as well.
There'll be individual climate control in every treatment space. There'll also be larger spaces for clinicians to practice and nursing staff and support teams to work within to allow them for more efficient workflow.
With the way the new trauma rooms are set up, all the equipment will be able to be stored right in the room. The doors will actually go from clear to completely opaque for patient privacy. They're going to have what's called a boom, which is attached to the ceiling and can move around the patient. And on that will actually be medical gases and enable us to hook up the respirator and essentially, if we need to, have a mini OR right there in the emergency department.
With the emergency department expansion project, we'll also be able to incorporate a clinical decision unit within that emergency department space.
It essentially enables us to place patients who we need to make more decisions on or require further workup or require further consult specialties, but don't necessarily need to be admitted to the hospital. What it will enable us to do is get the patients out much faster and avoid an unnecessary admission to the hospital.
The wayfinding through the emergency department will be much easier so that locked doors will no longer be a barrier as you're trying to get to your loved ones in the hospital.
I'm very excited about this new expansion. I think everyone is. It's something that we need. It's something that the community needs. And overall, I think it just makes United Regional that much better.